I have to be a social worker because I want to help people to help themselves. As the NASW Code of Ethics states, the primary mission of social work profession is to enhance human well-being and help meet the basic human needs of all people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. I want to be able to provide individuals with the tools, resources, and advocacy to overcome current and future barriers that impede on them meeting their basic needs. All humans, regardless of race, class, gender, sexual orientation, religion, or socioeconomic status, should have equal access to human dignity, health, and human rights. However, there are barriers that stand in the way of these. These barriers may include oppression, discrimination, public policy, society, power and control, and inequality, among others. I have to be a social worker in order to help break down these barriers. The main way this can be done is by empowering our clients. Through empowerment practice, clients are recognizing their strengths and true potential to overcome obstacles that stand in the way of their needs and goals. Through using a client-centered, strengths-based approach, where our clients are telling us their needs and the barriers from obtaining those needs, we are involving them in a collaborative practice. These collaborative practices instill a sense of mutuality, respect, and equality, which allows the client to become empowered and invested in the change process. I have to be a social worker because I believe in creating growth-enhancing relationships based on mutuality and respect with the clients I work with. All of this must be done through evidence-based practice. Competence and integrity are both considered core social work values and should be upheld at all times. Therefore, I will research and share resources with my clients that will help them to meet their basic needs when inequities in power and privilege have deprived them of these. Additionally, I will make sure that I am constantly researching and educating myself on new information, trainings, interventions, and readings in order to provide my clients with updated, evidence-based practice. I will continue to interact with other professionals in multiple disciplines in order to provide my clients with the highest level of care. These practices and interventions are going to be what will begin to create cracks in the barriers to human dignity, health, and human rights previously discussed. I have to be a social worker because I put a high value on professional education and an ongoing learning process. I have to be a social worker because there is absolutely no valid reason why every single individual shouldn't be having their basic needs met.